for healthy people?
Well, sometimes the lack of good data does not mean that the vaccine is not effective. So I think that needs to be taken into account. The vaccine is not very expensive. The vaccine is reasonably safe. The vaccine has been used for a long time. If you're asking about local data in Saudi Arabia over the years, in relation to the Hajj, in relation to H1N1 pandemic, how much mortality, has it killed anybody? I can tell you, influenza kills. That I have no question in my mind. I don't think any...
لا الحج احنا بنعتبره high risk.
No, but I'm just saying, as far as a mortality, as a cause of mortality, there's no question in my mind, and I'm sure, I don't think anybody in this room would debate that influenza killed a lot of people. And I think 2009 was a good example. On a global level, there were a significant number of mortality due to influenza H1N1. It was actually the young, the healthy, the pregnant ladies, the obese. There were certain risk groups that tended to be having a high mortality. And I've seen patients on, I'm sure most of us who are practicing physicians have seen patients on the ventilators for months from influenza and necrotizing pneumonia from influenza. And that scares. It scares me as a physician, as a public health officer, as a decision maker. And that's why I think influenza vaccine does have some advantage from the poor data that's available. It's very difficult to sort of define how effective it is, but we know from data that's generated from the H1N1 pandemic, and I know that this data is not included in your meta-analysis or in your Cochrane review.
But it's being updated at the moment.
Yes,
so
there is definitely, over the last year and a half, there've been, I would say, at least 50 or 100 publications from many countries across the globe that showed that people who received the influenza vaccine had reduced incidence of influenza. People who received therapy once the influenza happened and quickly, they had less mortality. So if you ask what I would recommend, I would not be out of line from what the other international bodies recommend, whether it's WHO, CDC, HPA, or NHS, or European CDC. Which has no reservation about the use of influenza vaccine. I have been using myself and my family, including my wife and my children, influenza vaccine every year, as long as I can remember, being through medical school, being through residency, being through fellowship, being a consultant, being at the Ministry of Health. I take the influenza vaccine every year. Alhamdulillah, I've never had any complications or issues with the vaccine, and it's hard to say if it's effective or not. As it was mentioned very clearly by Dr. Ghada, there are 200 viruses that causes upper respiratory tract symptoms, or ILI, and people who acquire RSV or adenovirus or any of the 200 viruses after they receive the influenza vaccine, they claim the vaccine was not effective, but it's not. It cannot be said without having a proper specimens. Surprisingly, in 2009, we took 3,000 samples from pilgrims who had symptoms of ILI, and only 2 out of 3,000 had influenza. The most common cause of upper respiratory symptoms was rhinovirus. So there are many. There was rhinovirus, there was RSV, there was adenoviruses, and these viruses do cause ILI. And for the physician, whether he's a senior consultant infectious disease or a GP or a resident or intern, patients look the same. There's no difference in symptomatology, there's no difference in clinical presentation. You cannot tell if it's a rhinovirus, RSV, or influenza A, B, parainfluenza, and so on and so forth.
Okay. So for what I understand is that the Ministry of Health توجهها يعني إنه it will make the vaccine available for those who want, but there was no recommendation, at least this year, that people should take.
No, there is a recommendation every year. Again, it's discussed at the